Now, one further thing about this virus. There's now even more evidence that it started spreading a lot sooner than we thought. And that's actually important. Now, I told you a couple of weeks ago about a study at Cambridge University that found there are actually 3 types of this virus now in humans. There's the first or parent type, type A, which then mutated into a type B, which in turn mutated into type C. And this team said that the parent type A actually started 800 kilometres away from Wuhan, where we all thought it started. And by the time it got to that city, it had mutated into type B. And that mutation process can take 3 months. 3 months. So this virus could have been around for that long before China registered its first official case in December. And in fact, Europe, it registered its first case in January, first official case, but a prominent French doctor said his hospital had retested swabs from a patient treated and found that this virus had actually been around a month earlier. Okay, but now comes more evidence. In Britain, epidemiologist Professor Tim Spector has been tracking reports of people who were complaining of the symptoms of this virus, the classic symptoms of this virus, long ago. And he says it was probably in Britain 3 or 4 weeks earlier than thought. And he says the reports I'm getting from people who are ill from early January onwards, they strongly suggest they had COVID-19, but were not recognised as such. But here comes more intriguing evidence from a US study of satellite pictures that found unusual traffic at hospitals in Wuhan as early as October last year, 2 months before the official case. Now have a look at this. It shows that cars parked at Wuhan's Tianyou hospitals, for instance, went up from 171 cars in October a year ago to 285 by last October. Same story at the Zhongnan hospital, from 506 cars a year earlier to 640 last October. And at the Tianyou hospital, cars doubled in the year to last December. Now,
the hospital is busier, likely because maybe something's happening in the community, an infection is growing and people have to see a doctor.
Now, I know that John Brownstein, who's the head of this study, and he says himself this evidence is not conclusive. Of course it's not. But there's also more that suggests that this virus was around months before the first official case, as early as September or October.
What we found is people were searching for terms related to diarrhea, which we know now is an important symptom of COVID, as well as cough. And these things were starting to increase, late summer and early fall.
So why is this important? Well, it raises some big questions. First, did China cover up this new virus for even longer than we thought? And second, even if it didn't, even if it just got caught by surprise like the rest of the world, did this virus infect many more people than we know before we knew it actually was around, which would suggest then that it is also not quite as lethal as we think, even now. Watch this space.